Back, vertebral curvatures, fetal curvatures. There is a universal attitude of flexion, dorsal convexity, kyphosis. Secondary curvatures. There are curvatures acquired after birth, cervical lordosis. It is the anterior convexity of cervical region. It starts to develop at 2 months of age due to neck holding. Lumbar lordosis. It is the anterior convexity of the lumbar spine. It starts to develop after 10 to 12 months after birth due to sitting, standing, and walking. Primary curvatures. They are present since birth. Thoracic kyphosis. Sacral kyphosis. Important information. The center of gravity in a pregnant female shifts forward. This is due to fetus developing in uterus on the anterior aspect of the body. This causes an exaggerated lumbar lordosis. Cervical, thoracic versus lumbar vertebra. Body of the vertebra. In cervical vertebra, it is oval, small body. Atlas has no body. In thoracic vertebra, it is triangular or heart shaped. In lumbar vertebra, it is oval or largest body. Vertebral canal. In cervical vertebra, it is triangular. Thoracic vertebra, it is oval. Lumbar vertebra, it is triangular. Characteristic feature. Foramen transverse areum. Thoracic vertebra, rib versus costal facets. Lumbar vertebra, largest body with no foramen or facets on transverse process. Direction of superior articular facet, backwards and upwards, and laterally. In lumbar vertebra, it is medially. The main point is, in cervical vertebra, the atlas has no body. Foramen transverse areum. It is the characteristic feature of cervical vertebra seen only in cervical vertebra. Foramen transverse areum. It is the characteristic feature of cervical vertebra seen only in cervical vertebra. It is present in transverse process of cervical vertebra. It is present for passage of vertebral arteries. Vertebral arteries, supply of circle of Willis, are present only in upper 6 cervical vertebra, C1 to C6. The foramen transverse areum of C7 has no vertebral artery passing through it. Vertebral arteries are present only in upper 6 cervical vertebra. The foramen transverse areum of C7 has no vertebral artery passing through it. Rib versus costal facets. They are present only on thoracic vertebra. These facets provide attachment to the ribs. Transverse section of spinal cord in cervical and lumbar region is triangular because vertebral canal in the cervical and lumbar region is also triangular. Transverse section of spinal cord in thoracic region is oval. Cervical and lumbar region is triangular. Thoracic region is oval. Cervical vertebra has smallest bodies. Lumbar vertebra has largest bodies. Atlas has no body. Ligaments of vertebral canal and spinal cord. Spinal cord is passing through the vertebral canal. Spinal nerves are coming from spinal cord. They exit through intervertebral foramen between pedicule of upper and lower vertebra. Ligaments. Anterior longitudinal ligament. It runs anterior to the body of vertebra. Posterior longitudinal ligament. It runs posterior to the body of vertebra. Ligamentum flavum. It connects lamina of adjacent vertebra. It lies posterior to the spinal cord in the vertebral column. Interspinous ligament. It is the ligament between spines of vertebra. Supraspinous ligament. It connects the spines of vertebra. Anterior longitudinal ligament, posterior longitudinal ligament, ligamentum flavum, interspinous ligament, supraspinous ligament. Anterior longitudinal ligament, posterior longitudinal ligament, ligamentum flavum, interspinous ligament, supraspinous ligament. Spinal cord is sandwiched between the posterior longitudinal ligament anteriorly, ligamentum flavum posteriorly. Lumbar puncture. Ligaments punctured in lumbar puncture, we will discuss it next topic.